This is the sixth of 6 videos leading up to my having 2 spinal fusion surgeries in 3 days and the aftermath. Now, I know some of you are here just because all you care about is the surgery and the aftermath, but the part leading up to this is really kind of nutty and might have some impact on things that you're going through right now. So at some point, you might want to go back and look at those. Now, some of you have looked at all of those, and now we're here at the last video, and we're going to actually get to the surgery and the aftermath. But I apologize to y'all because we need to go through some things for those who just came. So you can skip ahead and skip this history if you want. There's a lot of videos out there of people who go through spinal fusion surgeries. Most of them are L5-S1 fusion surgeries, which is a little less involved than what I went through. And pretty much all of them that I've seen start out day 1 with real loopy right after the surgery and then move on to week 2, week 3, week 4, and all that. I didn't even start making this until I was almost a year into it. I'll be 1 year away from the surgery in about 2 weeks. And the reason for that is these 2 surgeries I had in 3 days are my 4th and 5th surgeries. I've had 3 others, a laminectomy and 2 discectomies. And one thing I've learned in that is you can't judge what it's going to be like after the first day. In fact, when you wake up from the surgery, a common thing you hear is, I felt great. The pain was gone. Well, y'all, there's local anesthesia put in where they're working. And so when you first wake up, you're not going to feel anything there. It's not until that local anesthesia wears off that you begin to feel what it's going to be like after the surgery. And then you have a lot of them who, they're going along, they're saying, oh, this is good, this is good, this is great. And then they get to 6 months and they say, oh, crisis, pain's back, and now I shouldn't have done this surgery. I've seen people who took the screws out, and showed them to you and said, see? Now, the fact is, especially one that I'm thinking of, there's a real good chance that his pain was caused by the screws, but by then the surgery, the fusion had actually worked. But what was the problem was the screws had gotten loose, and so when they took the screws out, you were left with just the fusion, and he had no pain. But he was telling you, don't do fusion. Well, that's just crazy. Okay, so what I'm suggesting here is fine, watch all those. I did, and it was helpful. But take the pain and what's going on with them with a grain of salt until you look at it on down the line. And the other thing I want to say is there's a lot of bad surgeons out there, y'all. I used to think every doctor was smart and every doctor had good judgment and every doctor was probably pretty skilled or they wouldn't get out of medical school, because I've heard it's pretty hard. But what I found out is there are doctors at the top of the class and there are doctors at the bottom of the class. There are doctors who do fusions on backs that don't need fusions. So you're going to see what I've done here, and I made sure I was at the top of the class here as best as I could do. And I'm going to give a spoiler here. The fact that I'm sitting here doing this indicates the kind of outcome I had, because a year ago at this time, a couple of weeks from my surgery, ain't no way in that I could have done this sitting here. I would have been lying on the ground, because that's the only way I was not in pain. And even when I was lying on the ground, just to turn over was mind-boggling. I had to sit there and think about it for a little bit. If I was on the bed back there, I'd have to grab a hold of the edge of it and kind of go 1, 2, 3, go. And sometimes I couldn't make it. I would just scream and lie back down. It was so painful. So you're going to hear about the doctors who I finally got to help me. Now, starting to encapsulate all those 5 other videos that I've done in very brief few minutes here, we're going to start by me telling you that I had a primary care physician who was prescribing the opioids for me to deal with this pain, and he got me up to 120 milligrams of oxycodone a day, and then he added Valium to the mix, and a few weeks later, without any interaction with me, he just decided to stop. He wasn't going to give me any more, and he refused to help me taper. So I was looking at being cold turkey on 120 milligrams of oxycodone. This was all in the middle of the COVID and all that was going on, but I didn't want my 71-year-old wife to have to deal with me going through withdrawals cold turkey off 120 milligrams a day. So I spent $7,000 to try to do that in another setting. Well, that didn't work too good, and I ended up being a medical pariah. And then I had the most highly respected neurosurgeon in town who I really like, very personable person, smart, I know that. I have no doubt she is an extremely skilled surgeon. That's what all the testimony was of every medical person I talked to about her. But she got stuck on the wrong thing. And I'm not going to get into that now right this moment, but you're going to hear about that in just a minute. Now, I had a low backache at rest, and when I was sitting or when I tried to sleep, starting in my 40s. But that was handleable. In the daytime, when I was trying to work and I was sitting, I would stand at a desk and work, and that I could deal with that. And at night, I took medication. And you're going to have to look at the video to do that. I'm not going to get back into all that. But that's when I started taking opioids because y'all, NSAIDs are dangerous to begin with, but you take them long-term at high doses and you're asking for either a heart attack or you're asking to start bleeding out of your orifices. Opioids are a whole lot safer as long as you don't become disordered, and patients who are prescribed opioids, they rarely become disordered. So I was handling that back pain pretty well. But then in the spring of 2015, when I was 64 years old and I had been running 5 miles a day for about a decade by then, I was on one of my runs when I got hit by a pain in my hip, and that turned out to be the first iteration of my spinal stenosis. And I presume you know what spinal stenosis is. If you're here because you have an issue that requires fusion and you're looking for what the surgery is going to be like. If you want a better explanation, go back and look at one of the other videos. But I ended up having a laminectomy where they take part of the spine away that's pressing on the nerves that's causing the pain down the legs, which is what stenosis does. And that was in the spring of 2015. Well, the pain went away for a while, but in the spring of 2017, it came back. And my primary care physician at that point got me up to 60 milligrams of oxycodone after my neurosurgeon said further surgery probably wouldn't help. And so she sent me to a pain clinic to do steroid injections. And I did 3 of them and none of them worked. So I just kept taking the oxycodone and I could do pretty much what I wanted except run at that point. I did yard work. I did lots of stuff. And then in the spring of 2021, I did this dumb thing. I picked up a laundry basket full of groceries, actually. The groceries were in the laundry basket because of COVID. That's, again, another story you can see in a previous video. But it was very heavy, and I picked it up just like you're supposed to. But by the time I got downstairs and into the basement kitchen where I was taking it, I twisted wrong and ended up with a herniated disc with a lot of pain that the 60 milligrams of oxycodone I was taking just didn't help. So in December of 2021, the neurosurgeon did a discectomy to try to get all the goop that was squirted out of the disc because of the herniation out of the spine to take pressure off the nerves. And it helped for a little bit, but then pretty soon I was in more pain. And it was getting to where it hurt to when I even sat. A year later, the neurosurgeon did another discectomy, almost exactly to the day 1 year after the first one. This time she called it a re-exploration of the L5-S1 area. And again, I had a little relief. I mean, I don't know, less than a month. And then the pain came back. And this time I couldn't even sit. So she said, again, no more surgery is going to help. And I ended up having a second and then another round, a second and third round of injections in 2022 and 2023, and those did jack diddly. And then in July of 2023, my neurosurgeon, in an appointment we had, indicated that she thought my pain was caused by opioid-induced hyperalgesia. That's a paradoxical pain that you get when you take high doses of opioids, and especially over time, and you end up having the opioids causing the pain rather than helping with the pain. Now, I knew about that way before she talked about it, and I had been checking into it, and I had had contact with people who research opioid-induced hyperalgesia, and I didn't fit the criteria for OIH. OIH is systemic. If you have opioid-induced hyperalgesia, you have unusually high pain all over your body. And one of the things they say is if you have blood drawn, for example, usually that's a little bit of discomfort, but if you have OIH, it really hurts. Or if you have an injection injection, which is normally a little bit of discomfort. Well, I had injections out the wazoo getting vaccines for COVID and other stuff, flu and everything, and I didn't even feel it. I hit my head, I banged my toe, it didn't hurt any more than normal. The only place that hurt more than it should was down my leg and across my buttocks when I sat. And every expert I talked to in OIH said I didn't fit the criteria. The doctor at the Plain Clinic said, you don't have OIH. And eventually, the doctor who did the surgery said, you don't have OIH. But anyway, even after she told me that she thought I had OIH, I didn't have any other options. She was the best surgeon in town. But then I was once again hit with the war on opioids. It has become the war on pain patients, and I talk about that quite a bit in the previous videos. From the pain clinic now, not of course my PCP, I got a new PCP, a great guy who helped me taper. I didn't mention that, but I did find a doctor who helped me taper off the medication, and then the pain clinic helped me. And I went from 180 milligrams of morphine, which I had been switched to 30 milligrams of morphine in 6 weeks, or a little more than 6 weeks, with no problem at all. But the pain clinic had me back on 60 milligrams a day, and that allowed me to do a little bit. When I took it, for about an hour after I took it, I could function slightly. But then the PA came in one day and said, we got a DEA letter and we can't have anybody having more than 30 milligrams of oxycodone. So that cut me in half. And at that point, I said, enough's enough. I need a second opinion. So I spent almost $2,000 to get one from the Cleveland Clinic. I looked around and I found out they had a great reputation for orthopedic and neurology stuff. And I had a session with a highly respected surgeon at Cleveland Clinic, and he looked at my MRI. I mean, when we met, he said, this is a no-brainer. You're the classic case of somebody who needs spinal fusion. I mean, like, you're the poster child for spinal fusion. So I talked to him about how difficult it would be to get to Cleveland because I couldn't sit, and really airlines don't like people who lie on the floor the whole trip. So he gave me a referral, and that's where we begin this video that's going to include my surgeries, both of them, and the aftermath as to what's happened in the year since I had those surgeries. So when I got home after the pain clinic had cut my medication in half, not their fault, they're a victim of the war on pain patients just like I am. When I got home, I was decided I had to do something. And I remembered the conversation that I had with Dr. Savage at the Cleveland Clinic. And I went back to the recording that I had made of that conversation.
People I know who are very good. There's a guy named Keith Michael at Emory.
So after hearing about Dr. Keith Michael, I did a little studying up on him at the Google School of Medicine, and I was impressed with what I saw. This is from the Emory website, and I did a little more studying and found out that he had gone to undergraduate school at Stanford in California, which is impressive, and then he went to Harvard Medical School. But then he went to Duke for his internships and residency, and it's hard to get better than that. And then he ends up at Emory with a fellowship and is on the faculty of the Emory University School of Medicine, and he's been doing this for a good while. So I was really impressed with what I found. So I looked up the phone number and called to make an appointment. I figured that was going to be like months before I'd get to see him, but this was early January of 2024, and I had an appointment in a couple of weeks, mid-January 2024. Before too long, my wife and I were driving to Atlanta. Let me say something about driving. I talked about this in the earlier videos, but for those who haven't seen those, driving was a challenge after sitting was a challenge because of the pain that went across my buttocks. I mean, it was really severe pain. So when I first tried to drive after that developed, I would get out of the car and lie down every now and then to let the pain subside a little bit, and I'd get back in the car. One thing that I found fairly quickly, a good place to lie down, at least Monday through Saturday, are church parking lots because they're empty. And I could drive to the back and get behind the car. I tell you, when people see an old guy lying down next to his car, they want to call 911. I didn't want them to do that. So I would look at Google Maps and I would find churches along my route so I'd be able to lie down. But after a little bit, I learned how to upload by lifting up off the seat. Left hand would lift up off the armrest and my right elbow would be on the console. And then I would steer with like this. And if a car came along that, there's a curve or a lot of traffic, I would sit down and just endure the pain until I could get by that and get back up again. And that's the way I drove to Atlanta. My wife can't drive in Atlanta, so it's a 90-minute trip from Athens, Georgia to Dr. Michael's office, and I made the drive. Now, once we got there, I was really impressed. I was scared at first because it's this huge building, and there's a parking deck next to it, and I thought this is going to be a mess, but it wasn't. It was very well organized, extremely well organized. You walk into a very nice lobby. There's a bunch of check-in stations there. Now, that morning, there was a lot of people there, so I had to lie on a little bench while my wife waited in line until it was my turn to be up there. After that, there wasn't never a crowd, but you go to this check-in place, and it only takes a minute, and then she gives you a little sheet that tells you where to go, which was, for me, was X-ray first. And so it followed the map to go up to 5th floor X-ray, and then you check in at this little place and then sit in front of the hallway where the X-ray stuff is. And very quickly, somebody was there to take me back and do some X-rays, and then they direct you back down to Dr. Michael's office where you sit down and it was just a minute, and all of a sudden we were in this little room. There was very little waiting at all anywhere. And this room, we sat there, and there was this display on the wall, a big one, and it had Dr. Michael's picture. And next to his picture was the education that I showed you earlier. But I was really impressed because at the bottom of that, it said area of interest for research, and it said outcome measures. And I really love a surgeon who wants to know what happened later after he had done his surgery. That was really impressive to me. And really quickly, Dr. Michael came in, and I was comfortable with him immediately. He was a very personable guy. He had a great sense of humor. And for me, it was particularly comforting because he's a doppelganger of Dr. John Dagley, who was a professor in my doctoral program. And I got to know and became really good friends with Dr. Dagley. And Dr. Michael, I'm telling you, I don't know, they were like brothers from somewhere. Very, very easy going. Great sense of humor, and so I was immediately in my comfort zone. Now, this appointment only lasted about 15 minutes, but it was a very efficient and to-the-point deal, and the display was showing my X-ray, and he pointed out different areas of the spine that was really messed up, and his assessment was the same as Dr. Savage's from the Cleveland Clinic. Dr. Michael said, "You are the classic candidate for a spinal fusion." Now, something else that really impressed me about Dr. Michael happened after I got home or a little later. When I read his notes from our appointment, I've read a lot of physicians' notes. This is by far the most accurate set of notes I've ever seen. I mean, he got everything right. My history was right. The description of the pain that I was in was right. The history of my medication was right. Everything was spot on. And that really helped me feel confident about this guy. Now, what his proposal was kind of took me back a little bit. He was proposing 2 surgeries in 3 days. In the highlighted part, you can see stage 1 is the first day, and that's called an A-lift. Now, an A-lift takes 2 surgeons. The other one turned out to be Dr. Tom Dodson, who has been at Emory for a long time. There's a lecture series named after him. I mean, he's highly respected. And his job was to cut me open and pull open all my guts over to give Dr. Michael access to my spine. And we'll talk about that more in detail later. And then for the second surgery, Dr. Michael was proposing to do a fusion using rods and screws and all that from T10 down to the ilium or the pelvis. That deal with 2 surgeries in 3 days was major back surgeries in 3 days was really daunting. And I'll talk more about that in a little bit. I mean, it caused my jaw to get stuck open and stuff. But Dr. Michael was very confident about what the outcome for this would be. Now, he didn't promise a pain-free outcome. He was clear to tell me what the risks are. But he said that by 6 weeks, I should be able to walk 1.5 miles, which was really comforting. I told him that if I could sit, I would be happy, and he said, "You'll be able to sit." I was also surprised to learn that the surgery would take place within about 6 weeks. I mean, I was used to having to wait months for surgery. So I left the office feeling pretty excited. At least there was something there that I could hope for. But I still wanted to get the opinion of my rockstar neurosurgeon, who I had been working with all this time. So when I got home, I called and made an appointment, and we had a televisit. So after I'd met with Dr. Michael, I was pretty much decided that I was going to do that surgery, but I still wanted to talk to my rock star neurosurgeon and see what she thought. I had a great deal of respect for her, despite my feeling that she was really stuck on this idea that I had pain from opioid-induced hyperalgesia, that was my main problem. So I met with her on March 5th, 2024 via a televisit, and these are the notes of that meeting. And just for those of you who might be listening, I'm going to read these notes because it's important that we look at them closely. Edwin Lee Wyrick Jr. requested a visit to discuss surgical intervention that is planned at Emory for his chronic back pain. He has seen an orthopedic spine surgeon who has recommended a stage 2 level A lift followed by multi-level thoracic to pelvis fusion. We went over several questions that Dr. Wyrick had regarding questions to contemplate prior to proceeding with the surgery. I told him that it is certainly a large surgery with significant risk undertaking and significant implications for long-term spine health. Well, certainly true, it wasn't a minor surgery. He has not gotten relief long-standing with multiple other spine surgeries. That's true. She has operated on me 3 times, 1 laminectomy and 2 discectomies, and I was worse after each one. Now, I'm not saying that's her fault, but that's just the fact. And then she adds, does not feel that a spinal cord stimulator is something he wishes to contemplate. Yes, that's true. I had just heard from 2 highly regarded orthopedic surgeons that my spine was really messed up. I mean, this wasn't some minor disc problem. This was a spine that had major problems. And a spinal cord stimulator, which the efficacy is kind of iffy anyway. And, I don't want to do an N of 1 decision, but my sister had a terrible time with it. I was just beyond the spinal cord stimulator. But now we get into where she really is. We have talked about his significant pain, somewhat atypical for the type of spondylosis he has. Now, the 2 orthopedic surgeons, highly regarded orthopedic surgeons, who, one from the Cleveland Clinic, one from Emory, both highly regarded places by all measures, they said when they looked at my images, no wonder you're in pain. It was obvious to them, so it wasn't certainly atypical in their minds. She goes on, I think he needs to be very realistic and understand clearly what the surgeon believes he can accomplish with a surgery of this magnitude. She was, throughout the conversation we had, she warned me a lot about surgeons who promise too much. And as I've told you, Dr. Michael did not promise too much. He was very careful to tell me about the risk and the possible outcomes, but he was confident that I would be better. But he never promised me any pain-free deal. I have also cautioned him that regardless of counseling, what she means is regardless of what Dr. Michael said, he is likely to have a long recovery, and this is not going to be an easy recovery. And why is that? The next sentence is what tells you that. That is certainly true in the context of his long-term heavy opioid use and the challenges with pain control in that setting. I'm just convinced that this brilliant, highly skilled neurosurgeon was so stuck, so opposed to the opioid thing, so stuck on that despite the fact that I didn't meet the criteria, just couldn't get past it. And that's just my opinion, based on this constant thing about my unusual pain, his type of pain, and all these notes that we've looked at previously. You haven't seen all those if you didn't watch the other 5 videos, but this theme of the kind of pain you have being the problem was throughout her notes beginning on July 18, 2023, when she first brought up this issue. And then this part with the question marks, I'm just astounded by this. I would also raise concerns about his history of sacral insufficiency fracture, his bone density, and any additional risk that might contribute. I was just astounded by this. Here's what's going on with this. I had an MRI in 2022, and I think another one was in 2021. I had 2 MRIs. I know one of them was in 2022 and one before that. Both of them said that I had edema or swelling around the spinal area, and the radiologist suggested several reasons for that. One of them was discitis, or infection of the disc, and there were some other things. But one of the things he listed was as a potential cause is an insufficiency fracture of the sacrum. Now, the sacrum is basically the pelvis, a rather big bone. And if it has an insufficiency fracture, that is almost always caused by insufficient bone density, or another word for that is osteoporosis. Now, I had never had a history of osteoporosis when this was suggested in this as a potential reason for the swelling in this MRI. I had had a bone density test about 5 years before this, and it was normal. So I didn't think that was going to be a reason for me to have it. But because of this concern, I was sent for a bone density exam. And here are the results. This was done February 7th of 2023, so a little over a year before these notes were written that we're talking about now. And you can see the impression, that's the key part to look at, in the middle of the page. Based on the World Health Organization classification, the patient's bone mineral density is normal. Patient's fracture risk is considered to be low. Somebody without osteoporosis, somebody whose bone density is normal, whose fracture risk is low, is unlikely to have an insufficiency fracture because my bone density is sufficient. It's in the title of the condition. I mean, an insufficiency fracture just kind of happens on its own because the bone's so weak. Well, my bone isn't weak. It's clear. And then something else that causes me to not understand that comment in the notes, we had done imaging studies also to see if there was any fracture. Now, she had at one point decided that it could be that my hip pain I was feeling here in my hip area was not nerve pain, but rather orthopedic pain. So she had referred me to the orthopedic portion of the group she practices with. And so I went and they examined me. They did x-rays of my pelvis, and what was found, no apparent evidence of acute fracture or dislocation. They didn't find any evidence of fracture when they looked at it. I had a CT exam that found no compression fracture anywhere in the area. And again, insufficiency fractures, look at any source. I mean, here's just one Healthline, which is a reasonably respected website, where we say even if other risk factors are present, nearly everyone with a sacral insufficiency fracture will show severe osteopenia on imaging tests. Osteopenia is a type of osteoporosis. It can happen with not as low bone density as osteoporosis, but I had normal bone density. And I just picked one of these out of a million. I looked at 100 of them. And over again, what you see is that insufficiency fractures are caused by osteoporosis or osteopenia, and I didn't have either one. So the question is, I can't help but think, did we review any of my history before we looked at this? Did we just see that MRI, the thing saying that potentially he had an insufficiency fracture, but didn't notice that in the records I had normal bone density? I don't know. So she continued to say, I told him that I think it simply comes down to a personal decision as to whether he's ready to undertake this type of risk associated with the magnitude of the surgery, the implications on function in the future, versus a trial of something less invasive, the spinal cord stimulator. Again, I was past that. Now, I want to reiterate that I still have a great deal of respect for this neurosurgeon. I have no doubt she's highly skilled. I just think she's stuck on this opioid issue and can't see past it. And, that's just my layman's opinion. But she didn't say anything to change my mind, so now I am truly decided I will have the surgeries. So when I called Dr. Michael's office to tell him I wanted to do the surgeries, it was exactly as he said. The surgeries were set for pretty much exactly 6 weeks from when I called. So it was early March. And the first surgery was on a Monday, April 8th, and then I'd have a day of rest. And the second surgery was scheduled for Wednesday, April 10th, and that's of 2024. So I had 6 weeks to think about this. Now, as I've said previously in the other videos, I haven't been too anxious since August of 2002 when I had my last drink. The Serenity Prayer became my good friend, and I really let go of things I couldn't control. Of course, I could cancel this if I wanted to, but I wasn't going to do that. Now, there was a reasonable good reason to have a little anxiety. I mean, this first surgery, they were going to cut you open in the belly, and then the vascular doctor is going to move all your innards aside so that the orthopedic surgeon, Dr. Michael, can get back to the spine. But what I was really more nervous about is what's that middle day going to be like? I just couldn't imagine the pain I would be in from all that kind of surgery they're going to do in my belly and all that innard stuff. And then to have to be there for a day, it just seemed like it was kind of daunting to think about that. And then, of course, the second surgery, they're going through the back, they're putting in screws and rods and all that stuff. So this is kind of a big deal. Now, I didn't particularly feel anxious, but obviously I was. It was an underlying anxiety because one morning early, I was in bed still over there and I yawned, and all of a sudden I couldn't unyawn. My jaws were stuck open. That was the scariest thing I've ever done. I've had some TMJ issues like clicking in the past, but this was just awful. I mean, I couldn't. And I was running through my head, emergency room, I'm going to have surgery. How do they unlock your jaws? And I kept working at it, and finally it went pop, and it came unpopped. Man, wow. So I looked that up at Dr. Google and found out how to get it unstuck if it happened again, and it did. It happened about 4 times, always at night when I wasn't thinking about it, and I would yawn too wide. But obviously I had anxiety. That was coming from anxiety because after the surgeries, hadn't happened since, and I hardly have any clicking since. So obviously I was a little nervous about what was going on. Now, one thing that helped me was my cousin Sherman. It turned out I found this out through our Facebook interaction, she had the ALIF thing through her belly a couple of weeks before I made this decision to have mine. So she was a little bit ahead of me, and I was able to get some feedback from her on how it went, and that was encouraging. She said it wasn't too bad. And I'm still hearing feedback from that, and she's still doing well. Well, finally, time passed, and April 4th came, and it was time to do the pre-surgery stuff. So we drove to Atlanta again, or I drove with my wife riding, and we went to the Emory Orthopedic and Spine Hospital, which I'll show you in the next section about that. But we went there and met with Dr. Jennifer Cully, who did the pre-surgery stuff, a lot of blood work, and she examined me and asked a lot of questions, and so I got cleared by her. And when she was done with us, we got in the car and made about the 10-minute drive to Dr. Michael's office, where we met with him. Now, even though I didn't see the notes until after we had the appointment, this reminds us of what we did. Once again, his notes were exactly right, and this is what I love about Dr. Michael. He listens, and he told me about a meeting that they have, I think it's weekly, where they meet with a bunch of surgeons and interns and medical students and so on, and they discuss cases. And he said they discussed my case for a long time, and it was decided that after the first surgery, they might decide to not do T10 to the ilium, but rather L3 to the ilium, about half the distance of what was originally proposed. And there's a lot of surgeons who they're not going to listen to other people, but Dr. Michael's not like that, and he's the kind of surgeon I want to have for sure. So with that done, finally, I was heading towards these 2 major back surgeries in 3 days. Well, I had a couple of tasks before surgery day, actually, that I need to talk about. One was finding a place for my wife to stay. They said I'd be in the hospital up to 7 days, and so she needed a place to stay while I was in the hospital. Although they do in this hospital have furniture in the rooms and allow somebody to sleep there, but that's not a very comfortable way to rest, so she needed to have her own place. So the first thing I did was look at hotels in the area, and they needed to be such that she could drive to the hospital without getting on Atlanta's interstates. And if you know Atlanta, that's hard to do. So I tried to find a hotel that was an easy trip to the hospital. And the ones that were in the area, I tell you, it wasn't good. I'm pretty good at looking at reviews and weeding out the nutty ones. Like I remember one time seeing a review for a place we stayed in Orlando. It was a Marriott place that they called a resort. It was a bunch of one-story buildings scattered over a pretty large area of land with lush Florida vegetation surrounding the buildings that had the rooms in it. And I remember seeing a one-star review there because the lady had seen a roach. If you're in Florida around lush vegetation, you're going to see a roach, honey. So I looked at these reviews for these hotels with that in mind, weeding out the one stars that were dumb. Here's the problem. When you looked at the little graph and you look at the one stars, about that big. And the one stars, a lot of them had pictures. And there was consistent talk about gunshots and stuff like that. I mean, it just wasn't good. So I went to the Airbnb route. And I really love Airbnbs as long as the owner occupied, or they're not in a residential area. But a non-owner occupied Airbnb in the middle of a residential area, that's called a hotel. And I just don't want to be involved in that deal. And that's a whole nother video we'll do. But I found an owner-occupied Airbnb that was really nice, and it was an easy drive to the hospital. So with that taken care of, the next thing I had to do starting a few days before the surgery was to follow this protocol that Dr. Cully in the pre-surgery visit had told me how to do, and that was using wipes and some type of lotion to disinfect your whole body. So you start that a few days ahead of time. I forget now, maybe 3 days ahead of time. With that done on Sunday, August 7, 2024, we drove up to Atlanta and got into the Airbnb, and I did my cleansing stuff, and then was up at 5 o'clock in the morning to be there something like 6 o'clock to this Emory Spine and Orthopedic Hospital. It's really a nice place. The really nice lobby and facilities and place to eat, and pretty comfortable for your loved ones to be hanging around because they're going to have a long wait. I did all the normal pre-op stuff, went into a space divided by curtains, and the anesthesiologist came by. I had to talk to them about my long QT syndrome gene that I have, and I'll talk about that in another video. But they have to be careful about the anesthesia stuff they use on me because of that. So we had that discussion. Dr. Dotson came by, the vascular surgeon who does the opening up of the gut part and dealing with the veins, and we'll talk more about him in a minute. He came by, Dr. Michael came by, and just the usual pre-op stuff. But before too long, I was rolled into the operating room, and there were probably 6 or 7 people scurrying around, all in scrubs, getting the place ready. And it was a normal operating room look deal to it. It had the big lights that are over you and all that. So I'm lying there on the gurney, and all these people are running around doing all this stuff. And all of a sudden, one of them says, "Oops." And I couldn't help but think about this.
Sternum shakes. Oops. And the patient said, "What did you say?"
And I said, "What'd you say?" And they all kind of looked at me, stopped and looked at me. I said, "Did you say oops? You don't ever say oops in a operating room." And they said, "We just spilled something." I said, "Okay." And then they finally got it and laughed a little bit. But so pretty soon in comes Dr. Michael and Dr. Dotson. And so this part always happens quick. Again, I've had many surgeries by now, and I know this routine. It doesn't take long once you're in the operating room to where you get knocked out, and I know the deal now. So they put the mask on me and talked, and then you can smell what's happening. You can tell when it's fixing to happen, and you got about 6 or 7 seconds to go. And I always say something, encouraging to them. When I'm having a colonoscopy, the last thing I say is, "All right, take your time and look for those flat polyps on the right." Boop, and I'm out. So I said my little thing to him, and next thing I know, I'm waking up in the recovery room. Now, before I go any further, I'm going to show you and read a little bit of the notes from Dr. Dotson, because this surgery didn't go as well as they had hoped in one sense. Now, those looking at this can stop and read it, but in case you're listening, I'm going to read what Dr. Dotson had to say. The first part talks about just how he sliced through the muscle and all that of the abdomen to get started. And then he said, by using a sponge stick, I was able to sweep the peritoneum. Now, he talked about the peritoneum is a sac that surrounds your innards. And what he does is move that whole peritoneum aside, as he says here. Again, he says he was able to sweep the peritoneum, that sac, and its contents are my guts, my innards, from lateral to medial. It was a very difficult dissection, and the entire case took 4 hours, which is unusually long for a single lumbar disc. Let me back up about that single lumbar disc. They intended to do replaced the discs from L3 to L5, but because of the problems that they encountered, they ended up only doing one. So he's writing this after the fact when he says a single lumbar disc. So it took 4 hours just to get one artificial disc in the spine. There was a rind over the L5S1 and the left common iliac vein. And these are two, the iliac vein comes out of the aorta. You've heard of an aorta dissection, what John Ritter died of, for example, the actor. And if you mess with the aorta, boy, that could be bad news. And if you mess with these iliac veins, that's not good either. I mean, if you mess them up. All right, let me start over. There was a rind over L5S1, and the left common iliac vein took up 4/5 of the anterior portion of the L5S1. That means the iliac vein was covering almost the entire area that was L5S1. Most of the dissection time was utilized trying to retract the vein, the iliac vein, from its position over the disc. Dr. Michael and I both worked on gaining an exposure, and again, it was quite difficult to do. He ultimately decided after he had both done our best, he could go ahead and open the disc and then make some decision about how best to proceed. And what he decided was to put in an artificial disc in that L5S1 space and not worry about L3 and L4. I mean, it was already 4 hours just to do one. And then once Dr. Michael was done, Dr. Dotson writes, I then allowed the peritoneum and its contents, I love the way its contents, that's my innards, to roll back into the left lower quadrant and close the fascia, and he closed me up. So Dr. Michael's notes on this part was not much because basically all he did was insert the disc into the L5S1. This was mostly a Dr. Dotson procedure of trying to get all that stuff in front of the spine out of the way so Dr. Michael could work. Now, look, you heard all that. This is why you want to have the best you can doing this. I mean, I don't want some, I'm sorry to say this, local yokel who does knees and hips and everything else trying to deal with my iliac veins that don't want to get out of the way and rinds that cover everything and all that. I want somebody who's done 1 billion of these and are well-trained and basically is all they do day after day after day after day because they know what they're doing. Now, I woke up in the recovery room and it was real vague, anything that happened there. I know that I was in there for a long time. It was late in the afternoon before I went up to the room, and I know there was some pain control issues right there in the beginning. But by the time I got into the room, late that afternoon, the only pain I had was a little incision pain when I moved, but I immediately was so much better. I told you have to be careful about making early judgments because they put local anesthesia in there where they work, and you got to wait for that to wear out. But by the time I got up in the room, that local anesthesia should have been gone, and I could turn over in bed. Now, I was put on bed rest. So originally, I was supposed to be able to get up and move after the surgery and on the day in between, but Dr. Michael didn't want me moving because of the problems that they had with the veins and all that. He wasn't convinced that that disc was going to stay there until he was able to secure it the next day or in the next surgery with the brackets and rods or whatever they were doing on the back. So I had to have bed rest. But I already knew that I had major relief in one area, which was I could turn over in bed. And the only thing that hurt, and not too bad at that, was that incision in my belly. I don't know what's going to happen the next day, and the day that I was dreading is about to happen. I'll go ahead and cut to the chase here. Well, I couldn't really test myself standing and walking and so on. The middle day turned out to be a great day. With what I could do, turn over in bed, and something else I'm going to tell you about in a minute, I was 1 billion times better than I had been the day that I was rolled into the surgery room. I mean, I hear people talk about their incision pain. It's about a 6-inch cut at least. I mean, it was a big cut in the belly. And then they did a lot of work in there and stuff. And I've heard people say, oh, I was in so much pain for so long. I don't know. Maybe they didn't have the kind of pain I did before the surgery. But whatever incision pain I felt, it was so much less than what I had been dealing with for 2 years that I hardly even noticed it when I was lying down. A little different when I got up later, but we'll talk about that then. Now, I want to take a minute to talk about this hospital. This is the best hospital in the world, I think. I mean, really, all they do is orthopedic stuff. So it's dead quiet. There's no emergency room. There's no people running around. I mean, it is the quietest hospital I've ever been in. Now, I was on the 4th floor, and for the first couple of days, I might have been the only one on there. There might have been one other person, maybe. But at the time we left, there was 2 or 3 other people on that floor. If I was going to have to stay in a hospital for several days, this is the one to stay in. There's another reason for that, too. The staff was, to a person, just absolutely terrific. I mean, fabulous people. They were all upbeat and positive. Now, if you have some problem with immigrants, you're not going to like this, because one of the things I enjoyed doing was asking them, where are you from? And, I had Jamaica. I wish I could think of some of them now. Maybe I'll write them on the screen when I do. They all spoke perfect English, and they were all just extremely competent and extremely positive. And one of the things I like, too, is that they were really conscious of infection control. Every time they walked in, they came in and paid close attention to keeping themselves hygienic. So really, kudos to this hospital, the environment, and the staff. Now, I've already said I could turn over without leg pain, that pain going down my back, that awful pain. It did hurt with the incisions. I was continuing to take the 2 15-milligram controlled release tablets that I had been taking before I went to the hospital. And then they offered me, I think it was 4 10-milligram oxycodones a day, immediate release. And I took 2 of those, not because I was hurting when I was lying there, but I wanted to stay ahead of any pain that might come. It's a whole lot harder to catch up to pain than it is to keep from having it in the first place. So I said I'll take 2 of those tablets, one every 12 hours. And that's what I did throughout my stay there. Now, I'm going to tell you one thing that happened, and this is going to be a little Uncle Eddie life skill. Okay, I had a Foley catheter inserted in there when I woke up. They put it in when I was knocked out in the operating room, but I woke up with the thing. And, that's uncomfortable if you never had a catheter, and if you don't know what they look like, here it is. And that deal, including the balloon, is stuck down your penis, if you're a guy, all the way into your bladder, and then that balloon blows up in there to keep it in there. But the catheter just isn't very comfortable. When you turn over, it irritates you and all that kind of stuff. So when I think it was one of the fellows came in, fellow, I mean Fellow, it's of course that's how you spell it. That's position. It's an almost doctor guy or something. I'm not really sure what that is, but they're like students. And one of them came in to check on me early in the morning. I mean, Dr. Michael always checked too, but this doctor was in. I was talking to him. And I said, can I get this catheter taken out today? And he said, well, you're going to have it back in tomorrow. And I said, yeah, but it's uncomfortable now. And he kind of looked funny, and he said, well, if you want. And I said, yeah, I would. So a little while later, this nurse comes in. Honey, let me tell you, life skill here. If you're going to have 2 surgeries in 3 days, don't take that catheter out in between. I'm telling you, I have dealt with a lot of pain in the previous 2 years, but that matched it. When they pulled that thing, and now they make the balloon go down, but still, you've got this kind of big thing coming out, and it's already irritated. And it was like, whoa, honey, when they pulled that thing out, that was something. And I thought right then, I knew right then I had screwed up big time. And I know why that guy, the fellow guy, had a funny look on his face, and I said I wanted to do that. So now, I was beginning to relax about, this worst day I thought was going to be the worst day between surgeries. Doesn't seem too bad. But now I got to worry about doing that catheter thing again the next day. Oh, man. I tried to practice my anti-anxiety strategy of staying in the moment. The definition of anxiety is a space between now and then. If you can stay in the moment, then you're not anxious. Anxiety is all about worrying what's going to happen in the future. So I really tried to not think about it. But for your sake, life skill, keep that thing in there if you're going to have to get it taken out again the next day. Okay, now here's probably the biggest deal, one of the biggest deals that happened in this whole experience. Dr. Michael ordered a CT. They wanted to check and be sure that the spacer disc that they put in the L5S1 space was still there and right, and I don't know what else. So they brought up a wheelchair, and I got out of the bed and sat in that wheelchair, and I had no pain. I could sit without pain. I mean, not too long before this, I had gone to the hospital here in town because I got one of those injections I talked about that we were trying to see if that would help with the pain. And I remember on that one, I had to sit in this, it was actually a bed, but shaped like a chair, and it was a real soft mattress. And that was excruciating trip from that room I was in into the operating theater where they're going to do the injection. I mean, it was awful. And now I'm sitting in a wheelchair, and I have no pain whatsoever. I told Dr. Michael, if I can sit, I'll be happy. As I said in an earlier video, if you can sit, you can be president of the United States like Franklin Roosevelt. And if you can sit, you can travel. And if you can sit, you can drive without endangering everybody by, doing this. I'm sitting right now. This is such a wonderful thing. If I've got other issues I got to deal with a little bit still, that's fine. As long as I can sit, I am happy. And so the day passed easily. I ate a little bit at lunch, and then I couldn't eat much because of the surgery the next day, but that was all right. I wasn't all that hungry anyway. The night and day in between the surgeries turned out to be no big deal. And now it's time for operation number 2. The next morning, this is Wednesday, April 10th, 2024, I was awakened early and pretty soon found myself back in the pre-op room with the curtained spaces and all the doctors coming by to see me again. And then before too long, I was wheeled to the operating theater, and once again, there was several technicians running around, only this time nobody said oops, which is good. And then pretty soon I had that thing on my face again, so I said, bye-bye, see you on the other side. And then you wake up. If you've never had anesthesia, there is no sense of passing time at all. They got the thing on you. The next thing you know, you're in the recovery room, waking up. Not like you lie there and you have dreams and you wake up and you go back to sleep. Hopefully you don't wake up. That wouldn't be good. Now, I just a minute ago looked through trying to find some videos where you could see what it looks like when they're doing spinal fusion surgeries, because I can't find any that I can use that aren't copyrighted, but go to YouTube and look for spinal fusion surgery, and you'll find some. I think they're doing them on cadavers, but they show you exactly how they do it. And have you ever seen your car being worked on at a body shop? That's what it looks like. I mean, they got a hammer and a boom, 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 and then they got a drill, and then they're screwing. I mean, really, it's just a body shop job. Here's an x-ray of what they actually did, and you can see all the rods and screws in this x-ray. Now, one thing I got to say, if they were able to get the proper torque, then obviously I didn't have osteoporosis. My rockstar neurosurgeon in Athens, who had in her notes worried about osteoporosis, even though we had all this evidence that I didn't have it, didn't have a problem with it, obviously. And it's held up for a year, so I'm good on that. Had a little accident there, so we're back good now again. Now, pretty soon, at least in terms of my conscious awareness, I was back in the room. And again, I had some pain in the incision sites when I turned over. While I was looking for those videos I was talking about, I saw some of the comments down there, and what I saw time and again, the comments, boy, it hurt bad the first week, or and boy, it hurt bad. I guess they didn't have the kind of pain I did, because anything that I had, any discomfort, and I call it discomfort, that I had after the surgeries I'm telling you, I had an incision in the front and the back, and all these people are talking about just in the back. But I had 2 big old incisions I had to deal with, and none of that ever was even within the same universe, a billion, zillion, million times away from the pain that I had before this surgery. And again, I could turn over, leg pain was gone. Well after the local anesthesia that they put in during the surgery would have been gone. And then later that day, I got to stand up and get out of bed for the first time. And that was amazing. I stood up. They had a walker like this that I'm showing you, not a rollator. You don't want a rollator when you're just having after the surgery. And I stood up, and I don't have a picture of that moment, but I do have a picture of me here on the porch. And this is the day I got home, right after I got home. It's the same kind of thing. Before all this started, I was 6 feet 1 inch. When they measured me at the pain clinic, I just saw this the other day, I measured at 5'8", 5 inches shorter than I was, and I was trying to stand straight at that. So when I stood up, my daughter and my wife were sitting on a couch right next to the bed, and I got out of bed and I stood up, and they both were just astounded. They both said, "Wow, forgot how tall you were." To be able to stand straight without pain, I mean, for years I'd been bending over to decompress the spine, and then for the last 2 years, when I was in such bad shape, I really bent over. And so they just were astounded to see me standing straight, and it felt so good to do that. Now, I also got to begin walking a little bit, so I would walk laps around the hallway on the floor I was in, and yeah, it was really painful to walk. But again, it was so much better. I wasn't getting those shots of it was all in the incisions. But for me, it was so much better than it had been that I hardly even noticed it. I did have to sit down a couple of times as I walked around and doing that because of strength issues, and I'm going to talk more about that later. So as I said earlier, I was taking 15 milligrams of controlled release morphine twice a day, which I had been doing before the operations. And I said earlier they had offered me oxycodone 4 times a day. I think I said 10 milligrams. Actually, I looked at the records again, and they offered me 5 or 10 milligram tablets 4 times a day. So I could have had 40 milligrams a day of oxycodone in addition to those 30 milligrams of morphine I was taking. But what I continued to do was to take 2 5-milligram tablets each day, and basically that was to stay ahead of the pain, as I said earlier. Because if I was lying still in bed, it didn't hurt. And really walking, again, all I had to do was stop, and the pain would go away. It hurt when I moved. And that really quickly, after I got home, I'll talk about that later. So originally, Dr. Michael had told me I would probably be there till Sunday, but when they came in on Friday morning early, they said, "You can go home today if you want." Well, the thing is, I hadn't had a bowel movement yet. You remember they moved all my intestines to the side, and that causes your intestines to get messed up, and they don't want to work again. So you're supposed to have a bowel movement before you leave, and I really wanted to do that. I didn't want to leave the hospital worrying about whether my colon was ever going to start working again. And if the colon wasn't going to start working again, I wanted to be at Emory, not in Athens, because they're the ones who had been working on me. So I said, I want to poop first. So they said, all right. And so later that day, I pooped twice, finally started working. So Saturday morning came, and I was set to go home. Now, something else happened on Saturday morning I noticed that I need to mention. I talked earlier in one of the earlier videos about how I had a left foot that had swollen up probably about a year before this operation. And I had gone to a vascular place in Athens, Georgia, where I live, and had it looked at, and I was wearing compression stockings because of that. But that had really stopped. That swelling had really gone away. But all of a sudden, Saturday morning, my foot was swollen again. But I didn't think much about that because it had been swollen in the past. But I'm going to talk more about that later. So one of the things I had been really scared about was the ride home. I had read again in a lot of YouTube comments and that sort of thing, and in these videos that I had watched of people's experiences having spinal fusion, one of the things I heard a lot about was how awful the trip was home, how painful it was to be in the car riding this soon after having this surgery. And I was going to have a 90-minute trip. My daughter was going to drive me. Well, we had that wonderful experience of saying goodbye to all the people who had been helping me during my visit there. And again, everybody was just fabulous. And I get down into the car. Well, the first thing I notice again is I can sit without pain. It doesn't hurt. Leaning back on the seat with that back incision was a little tender, but it wasn't any big deal. And the ride home was nothing. I had even looked into getting an ambulance to take me home because of all the horror stories I had read and heard on the videos about the ride home from the hospital. but it was going to cost a lot of money to have an ambulance, and the insurance would only pay for a certain distance, and we were past that. So I even thought about getting the ambulance to see how it was and then getting out and changing to a car just for the last 10 miles. But I finally decided I'll just gut it out and see what happens. Honey, it was nothing. A little tender when I leaned back on it. That was it. The ride home was zero again. Maybe it's all relative. Maybe because sitting was so hard and I was in so much pain before this that the pain that I had now was so nothing compared to that it just didn't really matter. And now I was done, and as always, the actual event, everything, the 2 surgeries in 3 days, the day in between, the recovery in the hospital, everything was a whole lot easier than I feared. Now the question is, how about the rehabilitation? So happily I was back home, and again, the main kind of pain, which I only called discomfort, was incision pain. You know, I've seen all these videos. I've watched 1 billion of them of people's spinal fusion experience, and so many of them talk about this awful pain, how bad it was for the first week or two, and again, for me, it was just mild discomfort. Now, I had also seen a whole bunch of videos about how to do things after the surgery. I had the physical therapy. I didn't mention this in the hospital. A physical therapist came to me. 2 of them did. One of them taught me how to go up and down stairs, and the other one taught me how to do personal care, how to get out of bed. And now, everything they showed me to do, I had already been doing for 2 years. I mean, I had to get out of bed by standing straight up and moving my whole body and stuff, because any movement that wasn't just bent over hurt like the dickens. So I didn't really learn anything new in those PT sessions. But if you haven't had the kind of pain I did, you really need to pay attention to what those folks tell you. I mean, I paid attention. I just already was doing what they told me to do. I had a grabber, which everybody said to get so that you don't bend down to get things. But really, I found it easier to squat and pick things up, hold my back straight and squat down. And I was less likely to bend if I did that than if I used the grabber, because even with the grabber, I would find myself bending over to get something. And if I just squatted, I would stand straight. So for me, it was better not to use all those tools that I read about or heard about in the videos. And I ended up using this walker for only about a week. What I found myself very quickly doing was kind of carrying the walker instead of, moving. I was picking it up and carrying and walking because it was just easier. I was pretty stable and it didn't hurt too much. So really, I had bought 2 walkers, one for the main floor and one for down here in the basement, and then also one for outside, 3 walkers. And I only used them for a week, so I'm ready for the next surgeries if I need them. The biggest issue that I had to deal with after the surgery was my swollen foot. As I said in the previous segment, it swelled up on the last day that I was leaving the hospital. It wasn't, like big time wompo swollen, but it was swollen. I mean, it looked like a baby's foot. You know how they look puffy? That's the way that looked. And I had some puffiness all the way up to my knee on my calf. My left calf, because of the nerve damage that I have down that leg, and I'll talk more about that later, the left calf had diminished to about half the size it used to be. And then when this swelling came up, it went back to what it was. I was talking to my physical therapist, Hank, not long after this, and I was telling him about the swelling. We were talking about it, and I said, really, I don't mind it. It makes my calf look big again. And he laughed. He thought that was hilarious. Probably not the way you want your calf to get bigger. But nerve damage kills muscles, and that's what happened there. And again, more on that in the next segment. But I had to deal with this swollen foot. I had sent a message to Dr. Michael's office telling them that it was swollen still the day after surgery and the day after I got home. And I got a call later that day from Dr. Dobson. Remember, he's a vascular surgeon who does ALIF surgeries with Dr. Michael. And Dr. Dodson called me on his cell phone. And he said, you need to go to the emergency room right now. And he wanted to be sure I knew to do that. He said, this is something that can knock you off. His concern was the swelling was coming from a DVT, or a deep vein thrombosis, blood clot. And that can kill you if it goes up into your lungs and your heart and stuff. And he told me that when I got to the emergency room, he wanted to talk to the ER doctors. So I went over to the emergency room, And when I got in finally, I told the doctors that Dr. Dobson at Emory wanted to talk to them. So I called him and they talked, and I ended up getting a CT exam with contrast. And I didn't have any DVTs that showed up in my abdomen or down my leg. So after that, I did a whole bunch of other studies in 3 different places. And meantime, Dr. Dobson got me in to see the PA who works with the head guy in the Emory University School of Medicine vascular department. So once again, I was seeing the top-notch place, and I went up there, and these are her notes. I'm just showing these instead of showing all these others because this pretty much sums it up at this point. At the top, she wrote, he has had several diagnostic studies and evaluations locally, and that means here in Athens and here at Emory up in Atlanta. Negative for deep vein thrombosis, and I'm not sure what SVT is, but it's another kind of thrombosis. Negative for that at St. Mary's, and then I had the deals at University Vascular. And then she's saying I was also evaluated at the local emergency department. That's the one I was just telling you about. And then she talks about wearing compression socks. Now, I want to look down at the bottom. By the way, she starts out, Ed is a very pleasant male accompanied by his wife. Every doctor that I read the notes on say I'm a pleasant male, and none of them find me confounding and confusing. If you don't know what I'm talking about, look at the earlier videos. I'm talking about my primary care physician who dismissed me for being confounding and confusing. Something happened there. I don't know what it was, but it's a crazy story. Anyway, they did a study there at Emory while I was there, and they basically didn't find anything. The only thing they found at the bottom of the report, the left common iliac vein appears partially compressed in the midsegment. Iliac veins are the right and the left, and they cross each other. And there's a thing called May-Turner syndrome where if the top one will press down on the left iliac vein, and that causes swelling. It stops the blood flow or slows it down, and it causes swelling in the leg. So they saw some compression there, but it shouldn't be enough to cause the swelling. And I just had another study done, a CT, just recently, and they didn't see any compression there. So don't believe that that's what my problem is either. Basically what everybody said, all these places was we'll just have to wait and see what happens. And I'll talk more about the swelling in the next segment. So let's talk about medication now. When I left the hospital, I was taking the 15 milligrams of controlled release morphine that I had been taking when I went into the hospital. And I was also taking 4 5 milligram immediate release oxycodone tablets. I quit taking the morphine, both tablets, no more morphine, the second week that I was home. So I was taking at that point 4 or 5 milligram tablets of oxycodone a day. Now, that was really to help with the incision pain. When I talk about the incision pain not being a big deal, I mean, it still hurt beyond just discomfort, but it was just so much less than I was feeling. I didn't conceive it as a big deal. And I also wanted to stop pain before it started. So I was taking that 20 milligrams of oxycodone because that's what I had been told by the doctors to do, and I wasn't going to argue with the doctors on that. Now, I know how important it is to start moving or to keep moving after these surgeries, so I wanted to start walking right away as best as I could. Well, when I went off to walk the second day I was home, I walked around the block 7/10 of a mile, and it wasn't hard in terms of pain. Now, it was hard. I had to stop 5 or 6 times on a round, but I could sit on retaining wall. Remember, I can sit down. I used to, when I made the same walk for the previous 2 years, using a walker, I had to lie down on the ground because of the pain. But I didn't have to stop because of pain. I had to stop because of strength, particularly in my left leg. You know, it's like when you're lifting weights and you do the first 8 or 9, good, you know, and then you start going because your muscles just don't want to work. And that was a problem I had with my legs then, particularly the left legs. Let me talk a little bit about the nerve stuff in my left legs that I really haven't mentioned before. I don't remember the exact timing for this, but it was around the time I think I had the herniation. I know it wasn't after that too far, and it may have been before that. But in the evaluation I was doing, I remember trying to stand on my toes for my rock star neurosurgeon here in Athens, and my tiptoes, and I couldn't do it. On my left side, right side I can push it up. Left side, it just won't go. Nothing happens. I say tiptoes, and it just sits there. Now, they're not dead. If you take a thumbtack and you poke in there, I can feel that prick. But the nerves don't make anything work. And I'm going to go ahead and tell you now that that's still the case. And it's been a year, so those nerves from below my knee down into my toe area, they're not going to come back. If it's been a year and they haven't changed, they're dead. Now, the question is, maybe if they had been decompressed earlier, maybe if my neurosurgeon here, instead of worrying about opioid-induced hyperalgesia, had looked at the MRIs like these other two doctors did and say, we need to decompress these nerves, maybe they would be able to be healed coming back, but I don't know. But it's something to ponder. Anyway, so the biggest problem I had with walking was strength, and this left foot is clunky. I mean, I don't have drop foot where it just bloop, but it also doesn't walk normally. I have to think about it to make it walk like you normally do, where you push off. I can push off with the middle of my foot. I can't with my toes, but the middle of my foot if I think about it. But if I quit thinking about it, then I'm kind of limping. And it's not from pain. It's because that left foot is just kind of bloop, bloop, bloop along. Now, I had a lot of pains in my back that would come and go. And they weren't minor, but they weren't nearly as bad as they had been before. And they would go away. I would walk along and I'd get, especially right here on the side, I would get this pain going, and I was afraid I was getting already adjacent disc disease from the L3 area just above where the fusion was, because that's kind of where the nerves come out. And they may have been irritated from being different or something. But for a while, it got blurry. Hopefully that'll get fixed. For a while, I had to deal with this random pain that would come and go, particularly in the left side of my back. I haven't had that for a long time, though. Okay, I don't know what the deal was with that blurriness, but I'm back. So I was walking 0.7 of a mile right away. I mean, a couple of days after I was back, I did that. And pretty soon, if I go one more little bit around my block, then it's exactly 1 mile. And I did that pretty quickly. Dr. Michael had told me his guess was that within 6 weeks I would be able to walk a mile or a mile and a half, I think he said. And I was walking a mile within days on occasion. Mostly I did the 0.7 of a mile because of that strength issue. And then I did a mile and a half in 6 weeks. And later when I met, I said, I did a mile and a half in 6 weeks. And I showed him my map, my walk app thing. And he said, I meant a mile and a half total for the day. I didn't mean all at once. And I said, well, I did it all at once and it was fine. Again, I kind of had that pain across the back that would come and go. That is now gone, mostly. Every now and then I'll feel a little twinge, but not much. So I kept taking the 4 or 5 milligram tablets of oxycodone for about a month, maybe 6 weeks. I had been given the option of getting the pain medication from the surgeon or continuing to get it from the pain clinic, but I was told that the surgeon didn't have to worry about DEA rules, where the pain clinic, as I've told you, did. So I chose to get the pain medication from the surgeon at first because I didn't know what I was facing. I mean, I was terrified that I was going to be in a lot of pain. And I sure would rather deal with somebody where the war on opioids hasn't become a war on pain patients yet, so that the surgeon could prescribe the amount of pain I needed it without worrying about some legislator or regulator intervening saying this is how much he gets to take, regardless of his pain. Again, that's a whole different issue. But people are dying because of these regulations we have on opioids that are not necessary. They're just mindless. Yeah, people are dying of opioid overdoses, but it's not people who are prescribed opioids for pain. Those are people who are buying stuff on the street and they're getting fentanyl-laced opioids and all this other stuff. And I'm going to have a whole video on that. Look for it. So by the end of the first month, I was down to 3/4 of those 5 milligram tablets 4 times a day. And by the end of the second month, I was taking 3.75 milligrams or 3/4 of a tablet twice a day, once in the morning when I wake up and once early in the evening, and then a half a tablet or 2.5 milligrams at lunchtime. That's 2 5 milligram tablets or a total of 10 milligrams a day of oxycodone. And I'm still taking that a year later, and I'll talk about why in the next segment. Now, at 3 months, I started on my old routine of walking 3 to 4 miles a day. I looked back at my Google map because I couldn't remember all the walks that I did. And I had a Monday walk, a Tuesday walk, a Wednesday walk. I wanted to kind of continue that pattern. So I went back. Google Maps keeps and some people don't like this because they're all concerned about privacy and stuff. I don't care. I like to have it. So I looked back at my walks from years ago, 2018, 2019, and I saw where all I'd gone, what they were, and I recreated those walks. Now, again, I had to stop every now and then and sit down and let the strength come back. And here's what my Sunday walk looks like. It's 4 miles. Now, the first time I went up a long hill, a hill that's about 3/4 of a mile and like this on one of those walks, I had a hip issue. I'd walked up the hill and then I turned left to go off in this direction, and I had this hip pain in my groin. That's where real hip pain is, and it scared me. I thought, oh man, now I'm going to have to get a hip. And it hurt for a little bit going home. But by the next day, it wasn't hurting, and it didn't hurt again until I went up a long, steep hill again. Then it did it again. But then it would go away. So I just stuck with it, and over time it went away, so I don't have that issue. But I had it right in the beginning. Now, I did have a really bad deal on these walks that I took, and this was many months, September 6, 2024, so many months after I started doing these walks. I was near my house walking along, and I had sped up because I was anxious to get home for some reason, and I was walking right near the edge. We have these asphalt streets that are about that thick on the edge because they keep laying asphalt over them till it builds up. And my right foot went off on the ledge, and my left foot, the dead one, the one that's numb and dead, flopped back and got caught behind my right leg. And man, I just went boom. I used to fall every now and then when I'd run, but when you on uneven sidewalks, but I'd be running along and hit something, but you go flying, you got time to tuck and roll and to do so. This was like no time. Boom. And I guess I automatically tried to protect my wrist and my arms because I let myself go down. I tried to catch myself, but my face just went right in the asphalt. I just thought, oh my God, I assumed that my nose was smashed into my face. I could taste blood in my mouth. I didn't know if I had any teeth left. It just boom. And I put my hands to my face and it was just all this blood. This is what I looked like in the emergency room. I drove myself to the emergency room. Now they did a CT of my head. I take aspirin, so I was really worried about brain bleed. Once I found out I still had a nose here and my teeth were still intact, my concern was, am I going to have a brain bleed? So they did a CT for that, and it looked all right. But that was pretty scary, and I'm going to fall again at some point. I just try to be prepared for it all the time, and I try not to. But I think that's just where I am now. But hopefully I won't have something this bad. So that's what happened after I got back from the hospital. Next question is, where are we at now that we're 1 year post-surgery? As I'm sitting here, I'm 14 days away from the year 1 anniversary of these 2 surgeries in 3 days. And I'm happy to report that I'm still doing terrific. It doesn't mean I'm pain-free, and I'm going to talk about it in a minute, but so much great stuff has happened in the past year. Let me start with this. On August 17th, I had a follow-up visit with Dr. Michael, the surgeon who made all this possible, and I was so happy to present him with a gift. Here it is. I gave him my I am okay sign. I signed it for him, and he was so happy to get it. I didn't need it anymore because look at me there. I'm standing up, and I'm not in pain. So I signed thanks there at the bottom and signed my name to it, and he happily took it away, and he told me later that it's hanging up in their conference room. I was able to give him that sign because I am okay. I am so much better. And I had so many firsts after 4 years of being unable to do stuff. First, a couple of years due to COVID, and we were isolating. And then for 2 years, I couldn't sit, stand, or walk. I haven't talked about this. I did mention this earlier, but I did all my eating lying down. I couldn't sit to eat, and that caused problems. I started having esophageal problems, and I never had that before. And I realized that was come because I was trying to swallow lying down. So I got to where I had this tray, and I would eat lying, I would put it in my mouth, and then I would sit up despite the pain and swallow and then go back down again. I mean, that's the kind of stuff I was having to do. Now, look at this. There I am being able to eat my first meal at home, sitting in a chair. You just don't know how exciting that was. And you know what that meant? That meant we could dine out for the first time in 4 years. Again, isolating 2 years, and then I couldn't sit. And I got to choose where we went. So I went to my favorite, Brett's Restaurant, locally owned restaurant in town that's really terrific. And Mrs. Brett, I'm not sure of her name, took that picture for us so we'd have a memento for the first meal out. And then we did something really, really terrific in August, and that was return to our favorite place, the beach. We go to this condominium down in Tampa. We've been going there for many, many, many years, but we didn't go for the last 4. Fortunately, the owner of that condo was still there, so we had a terrific visit. This is my Facebook post celebrating that moment. That was the first night we were there. That was so exciting. And then later in the year, we had Thanksgiving, and there I am in the blue, standing straight, pain-free, as I stand there. How terrific is that, to be able to celebrate with my family? We did gather for Thanksgiving the year before. We did go up to my daughter's house where we are here. But I spent most of my time lying on the floor. I tried to eat at the table, but it was really hard. What a difference a year made. And then here is something great. For 30 years, we have been fans of and had season tickets for the University of Georgia gymnastics team. That was the first meet that we had gone to in 4 years. We kept our same seats, our season tickets. We kept them all during those 4 years because I just kept thinking, surely I'll be able to get back there, and there we were. How terrific was that? Now, I've said this many times before, there are issues remaining. In fact, if somebody woke up who had no issues and they woke up today feeling what I'm feeling and dealing with what I'm dealing, they'd be going to the doctor. They'd be going to the surgeon saying, fix me. And this is something that's really important for anybody with these issues like I have, spinal stenosis, that sort of thing. It's a degenerative disease that you have. And one surgery is not necessarily and really probably not going to fix you for life. Now, here are some things that I deal with. I'm still learning how to walk again. I did physical therapy after these surgeries, and I really didn't mention that much, but the primary goal of the physical therapy I had after the surgery was to figure out how to walk normally again. And we did a little work on that, but I finally figured that out on my walks every day. I had a long history of walking, so I knew this. Everybody was passing me by. I felt like I was moving pretty fast. And then I'd see everybody else going by me. And what I finally figured out was I was shuffling. I had spent years on a walker, and when you do a walker, you just take little steps. And when I started lengthening my stride, then I was getting back to having the speed I was used to as I walked. Now, I'm still can't do it. If I concentrate, I'll lengthen my stride, and as soon as I quit concentrating, I'm back to shuffling. It's going to take a while for me to get that to be routine again. And another issue is causing problems with walking, and that is, as I've talked about before, my dead left foot. The nerves from the knee down to my left foot, and it gets worse as the further down you go until at the foot it feels just numb as can be. Again, there is some swelling there, and first I thought it was the swelling I was feeling, but I don't believe so now because it's not that swollen. It's just dead. I can't stand on my tiptoes, and so when I walk, as I mentioned a little bit ago, I can't push off with my toes the way you normally do. I'm trying to do that with the ball of my foot, but that still causes a little limp and affects my stride as well. So I'm still working on that. Now, this numbness down my leg gets worse as the day goes on. When I wake up in the morning, it's numb, but as the day goes on, it gets number, and it begins to ache, so that by the evening, there's kind of a burning, achy feeling there that's really uncomfortable. And that's why I said I would tell you why I'm still taking oxycodone a little bit. And that's why I don't really need it in the morning, but you want to stay ahead of the discomfort. And that's what this is. This is discomfort. If I didn't take the oxycodone, I would be okay. It's just, why suffer? Because there's something you shouldn't be taking this. Well, that's BS too. And I sure as heck not going to take NSAIDs for the rest of my life because those are dangerous drugs. And I've shown no sign of disorder with opioids. So that's why I'm taking them, because this numbness becomes worse as the day goes on and it becomes uncomfortable. Although, again, it's so nothing compared to what I was dealing with before that I want to make that clear. Now, I've had another issue during the night as I'm trying to sleep. I talked in earlier videos in this series about the backache that I had in my 40s that started my back issues. A twisting kind of tight ache that I had at rest when I was sitting for a long time or when I was lying down trying to sleep. Well, it's crazy. That went away as my stenosis pain down the leg got worse. That backache at night just kind of disappeared. Now, I don't know if that's because there was something going on with my back or if it's because I was taking such high doses of oxycodone. Maybe that helped that, even though that didn't help the pain down the legs too much, as near as I could tell. Maybe that helped the backache, because as soon as I got home from surgery, that backache started at night again, and it's pretty profound. And I have that burning beneath the knee that continues when I'm lying down at night. Now, I don't want to take any more oxycodone than I'm taking, and I don't want to be taking it. I'm taking it every 8 hours, such a low dose and immediate release that it goes up and down in my system. But if I took another dose at night, I'm afraid I would become tolerant again. So I don't want to do that. But yay, my physical therapist, when I was doing it remotely, Marin, showed me how to use a TENS unit. And I put those pads on my back and on my leg, and I go right back to sleep. And the last issue I have is that I'm very careful about what I lift and not lifting stuff too heavy. But, you don't know if you've lifted something too heavy until you've lifted it. And on occasion, I have lifted something that was kind of heavy, and I have felt that sharp stenosis pain a little bit on my left side of the leg below the knee. And the first time that happened, actually, I didn't lift anything. This was early on after the surgery, or not too long after the surgery. And we had ordered from Sam's Club a case of water and some other stuff. And the water was on top of a box that had really light stuff in it, something that wouldn't be any problem for me to carry. But I wanted to get that water case off the box, so I just kind of pulled on it. I was careful to stand straight, but I thought I wasn't putting any pressure on my back, but as it fell off the box, I kind of reflexively grabbed it. And so I had a little more heavy than I really wanted to. And I got this pain down the outside of my leg, and that was the first time that happened, and it terrified me. I called Dr. Michael's office, and I said, I'm afraid I screwed the pooch, and I've ruined the fusion. I mean, this was really early on. And so they sent me to a place here, and I got x-rays, and everything looked good. So that was great, and it went away in a day. And I still have that from time to time. And in fact, I'm dealing with it right now. Yesterday, we had 2 shipments of dog food come, and there's 12 cans in a box. And they're not very heavy, and I've picked one up with no problem, but we got 2 yesterday, so I picked it up and carried it. And that was probably too heavy. It was, because I've got a little pain down my leg. But what I've learned is, so far, that's gone away. And it's the L5-S1 nerve path, so it's not adjacent disease like you get when the areas above the fusion are overused and then they start hurting again, or for the first time. So those are the things I'm dealing with. Learn how to walk again, dead left foot, and I'm dealing with the lower backache at night and some burning below at night. And that's dealt with TENS, and as soon as I get out of bed, that goes away. And as soon as I get out of bed and start moving, that goes away. And TENS unit helps both. So those are the issues remaining. Now finally, that leaves me with 3 takeaways. First thing is, do your homework. Don't just go to a doctor and go, okay. I mean, you need to educate yourself. So doesn't mean you're a pain in the butt to the doctor and you're telling the doctor what to do, but shared decision-making is something the medical community talks about all the time. There's a lot of doctors I found who don't want to participate, even though they kind of say they do. It's a really good idea for you to have some of your own information as you move through this process. I mean, there are so many spinal fusion surgeries, for instance, that are done for the wrong reason. So you want to be able to ask questions from knowledge, and you got to be real careful on how you do that, because there's a lot of quacks out there on YouTube. Just because you hear something doesn't mean it's true. But if you hear the same thing over and over again from the places that are the most highly respected places, like these clinics like Mayo Clinic and Emory and Cleveland Clinic and Lango Medical Center in New York, check all those places, and if they keep saying the same thing over and over again, you can pretty much believe that you're on the right track. Second thing is get the right doctor. Just because somebody is a doctor doesn't mean they're smart, doesn't mean they have good judgment. So do some homework on the doctor too. Don't just go to any doctor because your family's always gone to that doctor. Check them out. And then get a second opinion. Man, I wish I'd gotten a second opinion a lot sooner than I did. And all of the major clinics like Cleveland Clinic, Mayo Clinic, Emory, Langone, they all have second opinion programs. Unfortunately, they cost money, and so you may not be able to afford it. But if you can't afford it, get the second opinion from a really high-class place. So that's it. Man, we're done after hours and hours and hours. This is a crazy story. If you didn't see the first 5 videos and this is the only one you've watched, I wish you'd go back and look at the others just to entertain yourself. Meantime, I'll be working on a whole lot more videos. Like the next one I'm going to do is about when I was 16, taking my first solo cross country and got totally lost. It's a nutty story, and it'll be coming out soon. Meantime, it's always good to see you.